Hello, everybody. Welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, the thyroid pharmacist, and today I have a very special guest with me, a long-term colleague of mine, Dr. Eric Osansky. We're going to be talking about the natural approaches to hyperthyroidism and Graves' disease. Before I tell you a little bit more about Dr. Eric, I would love to welcome him to the show. Dr. Eric, thank you so much for coming on.
Dr. Izabella, very excited to be here, and thank you for having me.
It's such a pleasure to have you. I'm so excited for the opportunity to pick your brain. It's been a while since I've had the chance to do that. I really loved interviewing you for the Thyroid Secret, and I'm always learning so much from you about how to care for people with Graves' disease, with hyperthyroidism. And we're going to dive deep into some of the natural approaches to hyperthyroidism and Graves' disease. And definitely, I hope this conversation will be a healing part of your journey. If you do know anybody with Graves' disease, hyperthyroidism, and overactive thyroid, please share this conversation with them because it just might be the thing that helps them heal. So, a little bit about Dr. Eric Osansky. He is a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who has been helping people with thyroid and autoimmune thyroid conditions since 2009. He's the author of the incredible books, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, and the Hyperthyroid Healing Diet. He's also the host of the Save My Thyroid podcast. You can find my episode there as well. Dr. Osansky was personally diagnosed with Graves' disease, and after seeing how well a natural treatment approach helped with his condition, he began helping others with thyroid and autoimmune thyroid conditions. So it's such an honor and a pleasure to have you here with us. And I'm excited to share some insights with people. Now, I know probably when you were diagnosed with Graves' disease in 2008, I would love to hear your story. Were there a lot of natural treatment options and solutions that you can just access easily, or tell me how that went?
Yeah, well, I mean, in all honesty, it was all new to me. So as you know, my background's a chiropractor and was just practicing chiropractic for a number of years, for 7.5 years, and was a little bit overweight. Prior to my diagnosis, I was like dieting and detoxifying, and I was losing weight, which is what I wanted to do. But then one day I was walking around in a retail store, Sam's Club, took my blood pressure at one of those automated blood pressure machines, but my blood pressure was great, but my resting heart rate was a little bit high. It was around 90 beats per minute, and thought maybe it was just from walking around. And so I tested it the next few days, was anywhere between 90 and 110 beats per minute. And that's when I suspected something might be up. And shortly after, went to a primary care doctor, got some blood work, and and it made sense. I lost weight, but I lost quite a lot of weight. I ended up losing 42 pounds, which I wasn't aiming to. I was like 180 at the time, or 182, and I dropped down to 140, which was way too much. And again, had the heart rate, and then noticed eventually the palpitations and other symptoms we might end up talking about here. But as far as like a lot of natural options, at that point, the only education I got was going through my CE credits, continuing education credits. I attended some functional endocrinology seminars, and most of them focused on hypothyroidism, Hashimoto's, just because, as you know, that's a lot more common. But they did talk a little bit about hyperthyroidism and Graves, especially like symptom management, doing things other than antithyroid medication. So when I was diagnosed with hyperthyroidism and then eventually going to an endocrinologist and getting that Graves' disease diagnosis, I decided not to take the antithyroid meds, which is typically methimazole. And I knew I was going to at least try the natural approach, and not only the herbs to manage my symptoms, but try to address the cause of the problem. So I mean, I can't say it was like difficult to access that. It was just the knowledge wasn't like other than the CE credits. If I didn't go to those seminars, it wasn't like it is today, like with social media. I mean, obviously the web still exists, but here, there's now books like mine and others on Graves. And again, there's a lot more information readily available now than there was then. But again, I'm grateful that I did attend those conferences, learned a little bit about it, and then obviously learned a lot from my own thyroid healing journey.
I'm glad that you were able to take charge of your health and recover your health. And I agree, back when I was diagnosed too, a lot of the information was primarily accessible through like published medical research or through functional medicine or continuing education seminars. So I came across information that way as well. But there wasn't as much on like the internet as there is today. And it just goes to show how slow it is for information to kind of get from like the research and to the general public. And I feel like, unfortunately, the general public oftentimes knows this before the conventional medicine will kind of start recognizing it. I know with Hashimoto's, somebody recently had said to me the information, or maybe it was a book review, the information that I shared in my book was like common knowledge. And they're like, oh, everybody knows you need to go gluten free when you have Hashimoto's. Like, that's just common knowledge. And I'm like, well, yeah, but it wasn't when I first wrote about it in 2013. And I think probably when you were going through your journey, it was sort of like unheard of that you would turn down medications. And it was probably, had you not had that education and background, it probably would have been a very scary thing to not take the thyroid suppressing medications because the symptoms can be quite dangerous. Is that right?
Yeah. Oh, yeah. Without question, you want to be careful. You want to be safe while managing the symptoms. So definitely not recommending unmanaged hyperthyroidism because there are a lot of people who just don't want to take the meds, but they're not doing anything natural until they come across my information or other information. But also to add to that too, I mean, it's great these days that we have a lot of information, but we also got to be careful because as a result, there's also a lot of misinformation. Like if I want to know something about Hashimoto's, I know I could trust your sources, your books, and some other practitioners. And there's a lot of information out there that just people just randomly writing blog posts and filming videos and all that. So you do got to be careful these days as well.
Yeah, I totally agree with you. I know when I was first diagnosed, there was like something about rubbing coconut oil all over your thyroid gland, and it was like that's going to heal your thyroid when you have Hashimoto's or hypothyroidism. And spoiler alert, it does not. And then I saw somebody talking about how raisins like can heal the thyroid, and they quoted some study, and then I like looked at the study, and it was like no, like they don't. Like it's just sometimes I think there's things that are, I don't want to say clickbait, but that's kind of where I'm going with it, where people mention them just to kind of get views. And sometimes they'll try to share very controversial things, and they might not have like a healthcare background or a personal story with the condition. And so they might not even be aware that the information they're sharing isn't good, that it's not helpful, one, and that it might potentially be harmful. And so I really appreciate you sharing about like, okay, it's not just about like saying we're going to say no to meds. If you're somebody that is hyperthyroid, like you really need to manage that. And there are ways to do that outside of medications, but you also need to really be careful about monitoring and don't just like ignore it. Don't be like, oh, yeah, I'm just going to, hope and pray and figure it out and hope it figures itself out, right?
Yeah, I definitely agree because it's not even the overt symptoms. I mean, obviously, if someone has unmanaged hyperthyroidism, they're having a heart rate that's in triple digits, they know, well, hey, this is not great for the heart. But sometimes it's subclinical, not as common as Hashimoto's. A lot of times Hashimoto's is subclinical, or at least the numbers on the labs are subclinical, but even sometimes symptoms are as well. But with hyperthyroidism, you could have elevated thyroid hormones, maybe in some cases not have the stress on the heart, but it's affecting the bone density, which you can't tell symptom wise that the elevation of thyroid hormone increasing that bone turnover. So, but yeah, getting back to the safety and making sure that you're doing something to help lower those thyroid hormones, whether it's the anti-thyroid medication or it's herbs like bugleweed. And I also should add, herbs don't work for everybody. So there are some people that, I mean, they come see me, they're on the methimazole, and everything seems to be going okay. They're not having side effects or maybe even a lower dose. And I can understand them wanting to switch to to the bugleweed. But again, I'll let them know that I understand. And I mean, that's fine. I can't tell you to stop taking the anti-thyroid medication, but we could definitely talk about, the bugleweed. But just keep in mind, it's not always going to work in everybody. So I was fortunate enough, and a lot of people are fortunate enough where it does work. It is nice though that there are options, because there are also people who just can't take the antithyroid meds. It's not a matter of them not wanting to; they just are sensitive, have reactions to them.
Definitely. They are not the, I guess I would say, like thyroid hormone replacements. They're generally well tolerated. As a pharmacist with the medications used for Graves' disease, they are not generally well tolerated by a lot of people. So it's wonderful to have these options, alternatives that we're going to definitely get into as we have this conversation. I did want to, you're my go to person for Graves' disease and all things hyperthyroid. And I know there's a bit of an overlap with Hashimoto's and Graves' disease. And can we talk about perhaps some of the overlap as well as some of the differences for people listening?
Sure. So I mean, yeah, they're both autoimmune thyroid conditions, and so that's the big overlap is when we look to address both Graves and Hashimoto's. Again, it's the thyroid gland's important, but we got to keep in mind it's more of an immune system condition than a thyroid condition, and so we want to find out the underlying causes of Hashimoto's or Graves' disease. And there's different factors that could be triggers. There's food. There's stress could be a big factor. Infections like H. pylori and parasites could be a factor. Of course, we live in a toxic world, so environmental toxins and toxicants, including things like xenoestrogens, the microplastics, the glyphosate, mycotoxins, even. And so, yeah, I mean, though, and then obviously the gut, you need a healthy gut to have a healthy immune system because most of the immune system cells are in the gut. I mean, so yeah, with both Graves and Hashimoto's, there's very similar approaches. I mean, well, similar approaches, but obviously you get 10 different practitioners in a room. And I like to look at adrenal testing, but not every practitioner, like you have in your adrenal book, like questionnaires and all that. So people might not necessarily need to do adrenal testing. And then you have some practitioners that do food sensitivity on everybody, and then others who don't do food sensitivity. They do more of an elimination diet, but they still have in common, these practitioners still acknowledge, okay, food is a potential trigger, but there's different ways of evaluating. Adrenals and stress is a trigger, but again, different ways of figuring out. So yeah, I'm sure you agree with as far as like the different triggers and the gut, as far as that overlap. And we could get into the differences, which I spoke a little bit about the symptoms, but I'll let you give your feedback.
Yeah, I feel like there's always like, more than one way to peel a potato or whatever, right? Like there's so many different protocols out there that can be helpful. And whether it's an elimination diet or doing food sensitivity testing that is accurate, there are so many different ones out there on
Yeah.
the market. I've only worked with Alla tests and I found them to be accurate. With the other ones, I'm just not sure about. Like, I just don't have enough experience to say, like, this absolutely works or it doesn't. So my experience is some people will say, "Oh yeah, food sensitivity tests don't work." And I'm like, "But the devil's in the details. It depends on which test you use, right?"
Yeah.
And I think that's kind of an important consideration in people trying to educate themselves is knowing there might be different approaches and figuring out like how to get yourself better, dialing some of these things in, whether that is working with a practitioner on stress reduction, maybe they have some methods to do so, or perhaps they're going to help you with doing some testing. And I think both things can work depending on the practitioner and depending on the person. And both of, different approaches can also be ineffective in the same individual. We know that typically people with Hashimoto's, they might actually start off as hyperthyroid in some cases because of that thyroid destruction. And so they might appear hyperthyroid on tests. Do you see some overlap with that, or perhaps recommend different labs to determine what's going on with a person? Like, I know there's some people that might have both Hashimoto's and Graves at the same time. Sometimes people might switch between the two. Sometimes it might look like Graves, but it's actually Hashimoto's and vice versa. I'm hoping you can kind of give us a little bit of your insights on that.
Yeah, that's a great questions. I mean, you are absolutely right in that it's not only possible, but I find it's common for people to have multiple antibodies, like have both antibodies for Graves and Hashimoto's. So there's three main antibodies. So there's the thyroid stimulating immunoglobulins are the ones associated with Graves' disease, which is a type of TSH receptor antibody, thyroglobulin antibodies, which are more commonly associated with Hashimoto's, and then thyroid peroxidase or TPO antibodies, which are also more commonly associated with Hashimoto's, but actually very common in those with Graves too. And so what is hyperthyroidism too, like on a blood test? So hyperthyroidism, elevated thyroid hormones, elevated T3, T4, and then we got TSH, thyroid stimulating hormone, which in the case of thyroid hormone, in case of hyperthyroidism, we have low or depressed TSH because the pituitary gland does not want the thyroid gland to produce more thyroid hormone. So it's saying, let's stop that production of thyroid hormone. So you get that low TSH. So if someone has elevated thyroid hormones, depressed TSH, and let's say we look at all three of those antibodies and we see thyroglobulin antibodies and let's say TPO antibodies, thyroid peroxidase antibodies. So to me, I mean, I know the antibodies aren't perfect, but so there's always a chance of like false negative antibodies. But right off the bat, I'm going to suspect that the person might not have Graves and might have Hashimoto's and might be having that transient hyperthyroidism that you're mentioning. So if someone in that situation has thyroid stimulating immunoglobulins, and that's the only and that was my case when I dealt with Graves. I did not have thyroid peroxidase antibodies or thyroglobulin antibodies, and so in that case, I would suspect, well, if it's Graves and not Hashimoto's, and if someone has both of those antibodies, or all three of those antibodies, let's say, and if they're hyper, then it gets a little bit tricky. Then, I mean, still, in most, like when they're seeing me, it's usually more Graves. But again, is it a possibility that they can't, like it's maybe like Hashitoxicosis, but they still have the elevated thyroid stimulating immunoglobulins? I mean, with Graves, also, one of the, not everybody, but a decent number of people have what's called thyroid eye disease, where the immune system's attacking the tissues of the eyes. And so if someone presents with all three antibodies and hyperthyroidism, and they're also having some eye pressure, some eye bulging, then to me, yeah, it means that those thyroid stimulating immunoglobulins are kind of predominating, that it's really more of a grave situation in that case. Some doctors do what's called the radioactive iodine uptake tests, which I can't say I'm a huge fan of, but in the case of Graves, usually it would be like elevated. So I guess that's another sign. But yeah, I mean, sometimes it can be a little bit challenging, but usually between looking at the lab, seeing if they have potentially any eye symptoms, and just obviously evaluating them with the health history, usually I could differentiate between like if it is Graves or Hashimoto's. But again, sometimes it's challenging, and there's always a chance that someone could be hyper, and then eventually, they become hypo, and we see sometimes opposite as well, and that could be challenging because if someone comes to see me and they're on, again, I'm not prescribing the antithyroid medication, but they might already be on antithyroid medication. But if they really don't have Graves and they have Hashimoto's and it's just transient, they might eventually become not just hypo, but like super hypo because they're on the antithyroid medication. Hope that makes sense.
Yeah, I think it makes a lot of sense. And sometimes I've heard people describe Hashimoto's and Graves as two sides of the same coin, right? Two different sides where, you've got a lot of the underlying autoimmune triggers that could either express themselves with your thyroid becoming overactive or underactive, depending on where the antibodies are expressed. And so I know, from a conventional medical standpoint, the thing to do when you have hypothyroidism is to replace thyroid hormone. And then with Graves' disease, the thing to do is to essentially suppress thyroid hormone when somebody um, has Graves' disease or hyperthyroidism. And so some options might include doing medications like some of the ones we talked about, potentially methimazole, but also in additionally beta blocker to support, slow down the heart rate. Sometimes radioactive iodine therapy that destroys the cells of the thyroid gland so that it can no longer produce a surplus of thyroid hormone, or, a thyroidectomy or surgery to remove the thyroid gland. And then, of course, people, after the radioactive iodine therapy and the thyroidectomy, they end up having to take thyroid hormones, which, I feel like conventional medicine calls this a cure for Graves' disease, but it's like the cure is giving you another disease, right? So now you can't make your own thyroid hormone, but your approach is actually to figure out what the causes are and then use more natural therapies to support proper, hormone levels. So I would love to get into, and that way a person can save their thyroid. And I love that that is like the name of your podcast and you have an upcoming summit um, next month. And I'm going to put a link to savemythyroid.com/checklist where people can get a checklist on some of the things that they can look into when they have Graves' disease. But I love that you really focus on like saving that thyroid gland, and then people can have their own normal thyroid function, and they can get their Graves' disease into remission. So I would love to discuss perhaps what are some of the triggers and causes that you see? Can we do a bit of a deep dive for people so that they maybe have like a checklist on what things to think through? I know we already mentioned a few of them, right?
Yeah, so let's go through like the different categories. So again, like food, we you mentioned gluten earlier, and gluten could potentially be a trigger. Could also affect permeability of the gut, cause a leaky gut, which is part of the triad of autoimmunity. That could also be a factor as well. So things like so gluten, dairy, corn could also, in the literature, like corn has been shown to have like gluten-like response, not just because of the GMO. I know some people just jump, well, pop it if it's organic corn, and it has nothing to do with it being genetically modified. It's just like, so even if it's GMO-free corn, it could potentially, in some people, be a trigger. And that's what we should probably elaborate. This doesn't mean when we go down this list, it doesn't mean these are triggers in every single person, but the thing is, we don't know. Like, for example, dairy, there are some people that could tolerate dairy, but I don't know. So I usually tell people, let's take a break from dairy while healing. Doesn't mean that you necessarily have to give up dairy forever. Some practitioners would recommend for the autoimmune patients to do that. I can't say I do, but and again, we can always elaborate on that as well. But alcohol is another factor that, again, I wouldn't say directly triggers autoimmunity, but affects permeability of the gut, which again is a factor with Graves and Hashimoto's, and other autoimmune conditions as well. Salt. So salt is interesting because salt in the literature shows that it can increase Th17 cells. And again, not to say that having a little bit of salt or adding sea salt is a problem, but just overdoing it could potentially exacerbate, maybe even be a trigger of that autoimmune response. With Th17 cells, I know you know, Dr. Izabella, but for those who are not familiar with Th17 cells, you have regulatory T cells and Th17 cells. Regulatory T cells suppress autoimmunity. Th17 cells kind of promote autoimmunity. So when you have autoimmunity, typically you have an increase in Th17 cells. So again, the literature shows that salt can potentially increase those Th17 cells and be a factor in autoimmunity. And I mean, there are other foods that are, I mean, I don't want to say controversial, like nightshades as part of an autoimmune protocol. They're usually excluded, not necessarily because they are direct triggers of thyroid autoimmunity, but again, some nightshades, again, tomatoes, eggplant, white potatoes, peppers, might affect permeability of the gut. They have alkaloids, glycoalkaloids, which again could, in some people, affect the gut. Others, it might not affect the gut, but be inflammatory. And then others might be perfectly fine eating their tomatoes and peppers. But like I said, if we want to play it safe and want to take a break from those while healing, at least initially, again, some will choose to do that as part of that autoimmune protocol, AIP protocol. And yeah, I mean, there are other foods potentially, and again, there that we don't really talk about the diets which tie into some of these foods. I've been talking about like autoimmune protocols, but um, it's like some will say, well, how about eggs? I've read that eggs could be, a problem. And again, as far as an autoimmune protocol, eggs are avoided because, again, it's a common allergen, and there are some compounds in the egg, lysozyme, which could be in some people an issue. But eggs are also very healthy, nutrient dense, and if someone does take a break from eggs, those are usually what I recommend reintroducing first, just because it is a good source of protein and nutrients. Of course, makes a good breakfast food. So yeah, so I don't know if you want to, how deep you want to go into like the foods and diet before moving into like the next category.
I think what I will say about diet is I feel like sometimes people hear this and they think like, so basically I could eat ice cubes, right? And like that's not our goal. Is our goal is to like identify the triggers for that individual. I know with Hashimoto's, I've done some, food testing and just like outcomes surveys with my clients, and about 88% of people feel better off of gluten and they see major symptom improvements, and about 80% of people feel better off of dairy. For me, dairy was like a humongous trigger, but these days I can actually eat dairy and I can enjoy cottage cheese. Everybody's like, cottage cheese. I'm like, but it's my favorite dairy. I've never been a regular cheese person, but it's interesting. Like a lot of times people, when they have autoimmunity, there's something going on with their gut and it just becomes very permeable and very sensitive to a lot of different foods. And part of restoring the balance is going to be, how do we get your gut back in good shape? And part of that might be an elimination diet and staying off of the foods for a few months. It doesn't necessarily mean that you have to eat this way forever. And I know sometimes that can be very discouraging to hear, like, you can't have eggs and you can't have this. But I know you have a diet book, and I would love for you to share, before we jump into the other triggers, I would love for you to share a little bit more about what kind of a diet you might recommend, like sort of to simplify it for people a bit.
Sure. So the hyperthyroid healing diet, it might, maybe it should be called the hyperthyroid healing diets, because it doesn't just talk about one single diet. So it focuses on three different types of diets, and one is kind of like a modified autoimmune protocol, modified AIP diet, and which is the more restrictive diet. And I do recommend for a lot of my patients with Graves to start out with that type of diet. But again, there's no perfect diet for everyone's. And again, if someone is stressed out about the diet, that's not a good thing either. So like if someone's like, AIP is too stressful, I want to, I want a little bit more flexibility, then again, I talk about like a modified paleo diet. So there's some changes some tweaks that I make in the book, but essentially I call it like a level, the AIP, modified AIP, I refer to like a level 3 diet. And then a level 2 diet is like a modified paleo diet, which allows things like eggs and nuts and seeds. And then a level 1 diet is kind of, if you're familiar with Dr. Stephen Gundry, is like Plant Paradox book and Plant Paradox diet. So it's kind of like a modification of that, for more so for like vegans, vegetarians, just because if someone's, especially if they're like strict vegan, they might not only have difficulty following like an AIP type diet, but also a paleo type diet. So again, it's really just, obviously we all could agree, you and I, and then other functional medicine practitioners, avoid the refined foods and sugars, the unhealthy oils, and I mean, the fast food and all that. So, I mean, like someone might start with a level 1 diet, which is the least restrictive, and maybe they're not getting the results they see. And then they might want to try to consider like a level 2. And that's why it's nice if someone starts with a level 3, just because again, it's not nice. I know it's like Dr. Izabella said, it is more challenging, but we're not doing it just to deprive you. We're doing it just to try to eliminate variables, because it's a bummer when someone goes a few months and they're not getting better. And then we're suspecting, well, maybe if you did eliminate this food, maybe if you took a break from the eggs, that might have made a difference. Whereas if someone already took a break from the eggs for a few months, and if they weren't feeling better, at least we could say, well, we know that it wasn't because you were eating the eggs. But yeah, those are really the three different types of diets. And yeah, obviously I go into more detail with the book. But if you're familiar with paleo and AIP diet, especially essentially variations of those diets.
Incredibly helpful for Hashimoto's. So I think that's wonderful that sometimes people can utilize the same things and it just makes sense because you're supporting that autoimmunity and that immune system balance. As far as, one of the things that I was looking into when I was first diagnosed with Hashimoto's was for Hashimoto's, remission isn't that common, like spontaneous remission. And you kind of have to induce a remission in Hashimoto's. There's a way to do it, but it can be a little bit tricky. Now, with Graves' disease, there's like spontaneous remission. And in my experience, it's a bit easier to get into remission with Graves' disease than it is with Hashimoto's, which is another reason why I love your work on saving the thyroid so much, is because I feel like people should really give a chance to looking into the triggers, right? And figuring out how they can get themselves into remission before they go through with surgery or radioactive iodine, right? Give yourself a chance to get back into your good health naturally. What are some of the one of the things I came across is, and I've had some clients with H. pylori infections where if you find it and if you treat it, sometimes that can be something that gets Hashimoto's into remission as well as Graves' disease. Has that been your experience as well? And are there other like triggers you see like that when you're like, okay, we've got this. Like, we've got a really good chance of getting you into remission when we see this particular trigger present, and we're going to, find a way to treat it.
Yeah, I mean, I agree with the H. pylori. That's something that I recommend for just about everybody to test for, and it's not always a trigger. So like there are times when we'll address it and we retest and it's not there and the person still hasn't got into remission, and it is common for people to have multiple triggers. But yeah, there's also situations where H. pylori is gone, and the antibodies normalize, and yeah, so which is obviously awesome when that happens. Yeah, I mean, as far as especially looking at the gut, there's like in the literature, there's H. pylori associated with both Graves and Hashimoto's. Parasites, there's only a few case studies which relate to Hashimoto's that I'm aware of, like Blastocystis hominis. And there's no case studies in the literature associated with Graves, but I have seen people with parasites, again, where we address the parasite and they get into remission. And I actually learned the hard way. I hate telling this story because, but I'll tell it just for so others won't make the same mistake. But years ago, I had a patient who was not experiencing any digestive symptoms, and this was just when I started helping people with Graves, so I didn't have the knowledge I have now, but really no digestive symptoms. So I didn't want to do a comprehensive stool test, which I mean, admittedly, they're not perfect either, but anyway, I was like, yeah, you're, having regular bowel movements, no digestive issues. I don't think we would find anything. And he ended up going somewhere else. And the only reason I know is because I kept in touch with him, sent him an email a few months later, and it's like, yeah, I saw another practitioner and they did a stool test. They found parasites and they got rid of the parasites and I got into remission. And so that not only was proof that getting rid of parasites could help, but then also it's like, well, you can't always go by symptoms. How about that? Someone could have not only parasites, but even H. pylori. When people hear H. pylori, they think, oh, I have to have heartburn and reflux and all these symptoms. And a lot of people do, but some people don't have those symptoms. And that doesn't mean that you can't have it and or it can't be a trigger. So getting back to the original question, parasites, if I see those on a stool test, which again, it gets tricky because you could also have false negative parasites. They don't always show up, but if I see them, yeah, Yersinia enterocolitica is one that potentially could be a trigger as well. And that actually is in the literature with, I believe, both Graves and Hashimoto's. I know Graves, but I think Hashimoto's too. It could be also a factor. So as far as looking at the gut, those are the main ones. I mean, there's others like Klebsiella and Pseudomonas, which are more opportunistic, but could also be pathogenic. So again, just because you have them doesn't mean it's necessarily triggers. And a lot of times they're, yeah, I mean, they're a factor with the dysbiosis, the imbalance in the gut flora, but I wouldn't say necessarily triggers in most cases. I mean, molds and mycotoxins, which could also affect the gut as well. So that's why I'm tying it in here. You won't see that on a comprehensive stool test. You'd have to do like a urinary mycotoxins test. But there's definitely, I've seen where people test positive for molds and we address the molds and that helps greatly with them restoring their health. I mean, again, so those are some of the ones that come to mind as far as like, yeah, if I see, I mean, there are other things too, but as far as like, we're talking about infections and mold, not really infection, but I brought it up because it also, those mycotoxins also can affect the gut as well.
Yeah, I feel like mold kind of can act as like an infection and a toxin at once because it can colonize your body and then it sort of becomes an infection. I did want to ask you what kind of a parasite test that you're using and if there's particular parasites that you maybe see more of. What I mean, I'm sure some people listening are probably thinking like giant worms, that they're going to see in their toilet, but I would love your perspective on that.
Yeah, I mean, I like GI map, GI map. I mean, I also like GI effects from Genova. So both of those tests are really good. And, GI map is exclusively PCR when it comes to their parasite, where Genova looks at PCR and also like looks at, they also look at it the older way through the microscope as well. Blastocystis probably still is the most common that I see. And then like Dientamoeba fragilis is another one that I commonly see. I don't see a lot of worms, honestly. On the GI map, I can't say worms commonly show up on there. It's mostly the protozoa. And then there's also a test. I don't know if are you familiar with para wellness.
Oh yeah, I love
So
that test.
yeah, so para wellness, I learned I had Dr. Ami Kapadia on the podcast, and so she introduced me to para wellness, and I've had some people go through that. I mean, the downside of para wellness is not that this is negative, but it's only looking at parasites. So if you want, like, where GI map looks at H. pylori, looks at opportunistic bacteria, looks at, it's not the best test for yeast, but it looks at yeast. It looks at inflammatory markers like calprotectin, for example, secretory IgA. So para wellness, if you want a broad test, that's para wellness isn't for you. But if you want to just focus on parasites, para wellness is one that I've recommended to some people, and that potentially could pick up parasites sometimes when these other stool tests aren't able to.
Yeah, I found that to be the case as well, where I will have somebody do a GI map and like it's great because it'll show like that they have low fecal elastase and they may need some pancreatic enzymes or low secretory IgA. And so we know we need to support that to help with like the gut immune response, but it might miss some of the parasitic infections. And the para wellness test is like an old school, I want to say semi-retired physician, and I don't know if he is personally looking at the stool under a microscope, but they do examine the stool with a microscope so that you can have a bit more actual positives where I feel like unfortunately some of the newer tests, as amazing as they are and it's so many things that they look at, they just might miss those protozoa. And I think that's such a important and underappreciated cause. Interesting about Diantomoeba fragilis, I have seen that in some clients and I know that it can be a potent histamine producer, but I feel like it doesn't get enough attention that it should be getting. As far as H. pylori, I would love to ask for your thoughts on protocols. I know I used to utilize like DGL and mastic gum, and that worked really well for a lot of people before the pandemic. And then something happened during the pandemic. I don't know if it was stress or whatever, but everybody like it's just harder to get rid of H. pylori for a lot of my clients with those two herbs. And I don't know if you have another protocol that you like to utilize that might be a bit more effective.
I agree with you. It's H. pylori can be challenging, and same thing. Like in the past, just the mastic gum, the DGL licorice. I mean, those work pretty well. And then so you introduced me to Dr. Nicholas Hedberg, who I had on the podcast, and we spoke about infections. This was about 3 years ago, and he spoke about his like protocol, like triple probiotic protocol. and other protocols as well. And when I interviewed him, he was raving about the triple probiotic protocol. But again, now to be fair, this was a number of years ago, and I found that just that alone usually is not enough. Like they're just given the like a lactobacillus bifidobacteria, Saccharomyces boulardii, and a spore base are the three different probiotics. I still recommend that as part of my protocol now. Just and again, I could thank Dr. Hedberg for that. But again, just even though like if you listen to that episode, you'll hear him say that just the probiotics itself. But I think it's like you said, things have changed over the years. And so I think that I tried that just by itself for like 30 days, 60 days, a few months. And it's like, yeah, I need to incorporate more of the different natural agents because I do try to recommend not. I mean, if someone absolutely wants to get the antibiotics, that's up to them. But to me, that's like a last resort to take the antibiotics for H. pylori. So, I mean, I still think that mastic gum and DGL licorice can be beneficial, but then there's others like berberine. I mean, oregano, oregano is pretty powerful. You got to be careful with oregano too, because it's not, that's the thing when people think about these natural agents, they think it's completely harmless to the gut microbiome, but oregano, I do use it, but you don't want to take it like indefinitely. But oregano, I mean, allicin, which from garlic, could potentially also help. So, I mean, honestly, with H. pylori, I find that you have to go all out. And sometimes even then it's like frustrating. We'll do a retest and we'll see that it's still there. And then it's like, okay, what else, can we do, assuming the person has been following the recommendations. And sometimes just a matter of them going longer. Like, I like to have them retest after 2 months because some people, it'll be gone after 2 months. And I'd hate for them to take supplements for like 3 or 4 months, but it's a little bit of a catch-22 because if it's not gone after 2 months and then maybe they need to be on it for an extra couple of months. And as you know, everybody's different. So some people might be resistant to certain to certain herbs, and unfortunately GI map doesn't do that, but I think Genova does that, where they look at some of the, like they'll say, well, you're more sensitive to berberine or golden seal and or whatever, I forget. I think they might test for oregano. So it'd be great if all the tests did that, so like, well, let's not give oregano in this person because this person oregano might not be as effective. And unfortunately, if you don't have that information, you don't know until the person follows the protocol, and then you still see H. pylori there. And you can see that with the antibiotics too. And that's why GI map, they actually include like resistant genes to like antibiotics, to make sure if you take the antibiotics that you're not taking the ones that you might be resistant to.
Yeah, I think it's very helpful to make sure that you're utilizing different protocols and supporting sometimes you can support the gut and that helps with overcoming infections, but it can be quite tricky. And I know people have been like, oh, well, I already took some mastic gum and whatnot. And, I'm still having symptoms. And sometimes it's a matter of doing a retest to make sure that the bugger is indeed really gone. And I know in my training, I learned that it could be easily passed back and forth between spouses too. So like if you're, kissing somebody with H. pylori too, that can be something that you need to do is like, cause you could be treating yourself, but you could be reinfecting yourself too. Cause it's like, you use these herbs and then you get it back again. And I know, it's been one of those tricky buggers that's been frustrating, but definitely I think sticking through with the protocol to get it addressed can be very helpful for a lot of things, whether that's food sensitivities or preventing stomach cancer down the road and getting Graves and Hashimoto's into remission. So I wanted to check in with you. So we talked about some of the triggers and we talked about getting those addressed to get a person into remission. What about some of the different treatment options for Graves' disease that you find can be very helpful? And we mentioned a little bit about the conventional treatments, and I would love to, if you have some thoughts for people for best practices for those, as well as some of the best practices and perhaps things you like to recommend from a natural treatment standpoint.
You mean like the herbs like bugleweed, motherwort, some of those remedies? Is that what you were?
Yeah, absolutely. Any kind of things that you might recommend for, we talked about like getting the autoimmunity into remission, and then we could
Mm.
talk about like what do you do with the actual thyroid hormones because we don't want to have too many thyroid hormones on board. How do we get how do we normalize that TSH and how do we normalize that T3 and T4?
Yeah, great question. So again, there is a time and place for the anti-thyroid medication. So methimazole is usually given in the United States. Sometimes propylthiouracil or PTU is given if someone can't tolerate the methimazole, or if they're in the first trimester of pregnancy, then PTU usually is given. And again, time and place for those. The good thing about those is that they work. They almost always work. But again, the downside is that side effects are common. So if someone does take those, typically the endocrinologist will do a liver panel, maybe as part of a comprehensive metabolic panel, to look at the ALT and AST and make sure that they're not spiking up, that it's not putting stress on the liver. Alkaline phosphatase commonly will be elevated with hyperthyroidism, but that relates more to the bone turnover. A lot of people look at the elevated alkaline phosphatase and they're like, oh, my liver is a lot of stress on the liver, but it's usually that's more bone turnover in hyperthyroidism. And then they'll do a CBC, complete blood count, to make sure the white blood cell count is not depressed due to the antithyroid medication. So again, I didn't take the antithyroid medication, but I wanted to start with that just because it does work. Side effects are common. I get it. Again, that's one of the reasons I didn't take it, but you just got to keep in mind that natural agents don't always work. So that's one of those risk versus benefit things. But if someone absolutely wants to give the natural agents a try, oh, and also the beta blockers. So you mentioned beta blockers like propranolol, atenolol, metoprolol. Typically, like propranolol is probably most commonly given with hyperthyroidism because it also affects that conversion of T4 to T3. That helps to inhibit that conversion. So even if someone is unable to take the anti-thyroid medication, or if they don't want to take it and they're on propranolol, and that will it won't only help with the symptoms, but it also can help inhibit that conversion of T4 to T3, which also is beneficial for those with hyperthyroidism. One I want to throw at you, which I don't know if you're familiar with. I'm sure you're familiar being a pharmacist with the medication, but cholestyramine is one that also, like for someone who can't take anti-thyroid medication, cholestyramine is a binder and it's commonly not used for hyperthyroidism, but there are other purposes. In the functional medicine worlds, it's commonly used for mycotoxins as a treatment for mold to bind to the mycotoxins. But the literature shows that it actually could bind to hyperthyroid to thyroid hormone in those with hyperthyroidism. And I can't say I've had a lot of people take cholestyramine, but I have had some go to the endocrinologist who, let's say, if they can't take the antithyroid medication and present not my articles, because they'll usually shoot down my articles, but I tell them just show them like the journal articles, which you could find by visiting my website and my articles. And again, it does seem like it works, even though in the literature it says for mild hyperthyroidism. I've had people where the thyroid hormone levels are like moderately to severely elevated, and the cholestyramine works. So that's also another option. And then before we get to the natural agents, there's low dose naltrexone, LDN, for both Graves and Hashimoto's. So LDN, again, not addressing the cause like these other ones, but the advantage that LDN has when it works is that it modulates the immune system. And again, remember, Graves, Hashimoto's are more immune system conditions and thyroid conditions. And so LDN is also another option to look into. And then as far as the natural agents, so I took bugleweed and motherwort. Bugleweed is more of a natural anti-thyroid herb. And so I took that in place of the methimazole. And again, in my case, it worked wonderfully. Like I took it and I noticed pretty quickly like the decrease in heart rate. I mean, obviously I didn't know from a blood test standpoint because I didn't do a blood test right away. You want to wait at least 4 to 6 weeks. And even then I wouldn't expect it necessarily to normalize, but hopefully things are heading in the right direction. But again, symptom wise, I knew it was helping, but I was still having some heart palpitations. And so I added motherwort. Motherwort kind of like a natural beta blocker. Obviously, not exactly the same, not the same mechanism, but more for the cardiovascular symptoms. And so I added motherwort along with the bugleweed, took both at the same time, and that helped with the heart palpitations. And that's all I took, just because at the time I wasn't familiar with some other agents like lemon balm. Like lemon balm is common in hyperthyroidism. You'll see that in these formulations for hyperthyroidism. Some of them, these thyroid calming formulas, have bugleweed, motherwort, and lemon balm. So lemon balm has maybe mild anti-thyroid properties, but I mean, again, like it's to me, it's not like bugleweed. I mean, I recommend it more as a calming agent, especially if someone's having issues sleeping, anxiety. I might have them take that at night, or drink some lemon balm tea. Yeah, and then there's also L-carnitine. So L-carnitine in higher amounts. So, like again, Dr. Izabella might have spoken about like acetyl L-carnitine, or just even just at regular L-carnitine. Either way, like if someone takes 500 to 1,000 milligrams, like it doesn't seem like it's doing anything to thyroid hormone, and it's actually in the literature, it's not suppressing thyroid hormone at all. It's blocked, like in larger amounts, like 2,000 to 4,000 milligrams. It seems like it's blocking the entry of thyroid hormone into the cell. So if you're hypo, maybe you don't want to take that large of a dose. But if you're taking it for another purpose, like fatty acid oxidation, like 500 milligrams, 1,000 milligrams, especially of like acetyl L-carnitine, it does not seem to have that effect. And yeah, those are, I mean, there's also lithium orotate. You're familiar, I'm sure, with lithium carbonate, which in the past more so they used for depression, and found out that that can induce hypothyroidism. And so lithium orotate, not as potent, but that also could help some people as well with hyperthyroidism. And I think that's my list.
That's a really, really great and comprehensive list. And with L-carnitine, I love using it actually for hypothyroidism. And I don't remember why I started taking it, but I remember I had like pneumonia or something, and I had this awful, awful brain fog after the pneumonia, and just some like pathogens in my gut, perhaps. And I remember like taking L-carnitine and my brain fog lifted. And I was initially a bit nervous to take it because I thought it suppressed thyroid hormone because it's so beneficial for hyperthyroidism. And I did a little bit of deep dive in it, and I found that it's a mixed agonist. So the way that that works is basically it kind of works to balance thyroid hormones. So if you're overactive or underactive, it can be supportive of both conditions. And I know a recent study, there's so many studies in using it for hyperthyroidism and all the benefits, preventing muscle wasting, but there's also thyroid fatigue studies in people with hypothyroidism and even people who have had their thyroid gland removed, using up to 2,000 milligrams per day. And actually, 2,000 milligrams a day was right around the dosage that was studied, and that can support thyroid hormone levels. So it's amazing because sometimes we think of like, oh, this does that, but then we do more research and then we find out that it can just be very supportive overall. So that was a really cool thing that I learned. And I was, having a history of hypothyroidism. I was very scared of L-carnitine for a while, but it's been something that can work remarkably well for thyroid brain fog as well. And I have a funny story about cholestyramine. This is like a bad pharmacist story, but I had been using it. Like, I'm aware of all the drug interactions with thyroid hormone and whatnot. And I had used it before for mold toxicity because it's a great binder for getting mold out of your system. And I was using like just it comes in these packets, and I was using like one packet a day. And I was like, oh yeah, this is great. And then I decided to do it again, but this time I'm like, I'm gonna go through like the really high dose, and it's like, 4 packets a day to kind of get it out of, just to try to make sure I'm doing this really great cleanse. And I actually became hypothyroid throughout the process. And I was like, oh my gosh, what happened? I tested my thyroid function. And so interestingly, with the studies of that, it's like you do need to use a bit higher doses of it to get that. It enhances the liver excretion of thyroxine. So it can be used as therapy for hyperthyroidism. But again, if you are hypothyroid, it's like you want to be mindful of that and not take it too close to your thyroid meds. So I learned that the hard way and I was like, geez, like, I learned about this in pharmacy school and I totally forgot. I was just very, very focused on it as a mold detox binder, which it can work really well for. So a little bit of a funny story there. Sometimes we learn things the hard way on ourselves. I love that you talked about low dose naltrexone. I think that can be incredibly game changing for a lot of people in getting into remission. I know that it doesn't work for everybody, but it's nice to have that as an option. I did want to ask you a little bit about bugleweed and motherwort. Is there a product that you like to utilize, or is that use them in combination, or is there a time where you might use one or the other?
Good question. So with bugleweed, you want to, I mean, if someone's hyperthyroid, and you're going to choose between the two, I would say start with bugleweed, just because that is actually helping to suppress the thyroid hormones. And motherwort is, as far as I know, is not having a direct effect on the thyroid. So if someone's not taking anti-thyroid medication, let's say, especially, and you're looking to take one of the two, I would say take the bugleweed. This is important to mention too. So let's say someone's taking anti-thyroid medication like methimazole, and for whatever reason, they're still having some heart palpitations, and now they could go to their doctor and try to get a beta blocker, but they could also take the motherwort along with the methimazole. So that's also something that you could mix it. At least I've, again, you're the pharmacist, so like but I haven't seen like interactions between like methimazole and motherwort. So I'm not giving any advice in saying that but that's as my experience. I've had people take the methimazole with the motherwort, but yeah. So with the bugleweed typically is what my go-to as far as like brands. I don't know if I mean I do like MediHerb. MediHerb bugleweed is what I took. It's based out of Australia, and it's a 1 to 2 extract, which I find that, I mean, Herb Farm has a bugleweed, which is also seems like really good quality. It's just less potent. It's like a 1 to 5 ratio. There's also Hawaii Farm, which is also that's like a 1 to 3 ratio, and which is also seems like a good brand. So yeah, MediHerb is the one I use, and a lot of my patients take MediHerb. But again, in this day and age, of course, people get things on their own. So I've had people like, hey, I'm taking Herb Farm, and then Herb Farm has also like what's called thyroid calming formula, I think is the name. There's like, which is again the bugleweed, motherwort, and lemon balm. Now the good thing about that, it has all three, but in a way that's a bad thing too, because it has smaller amounts of each. So if you're really looking to focus on lowering those thyroid hormones, for some people it might work, but if it's not working, it might be because you need to take them separately, especially the bugleweed. And so that's the downside of like a combination formula. So I usually, if someone's not taking anything, I'll just recommend them individually rather than like a combination.
That makes a lot of sense because sometimes you might need to tailor the dosages and it's kind of like the devil's in the details. And I know it really helps to work with a practitioner and have that guidance because sometimes people might see something and they're like, okay, I need to take this, but it's not working, right?
Yeah.
And that could be the reason behind that. Do you have suggestions for thyroid eye disease? I know that this can be a very common distressful symptom that people face.
Yeah, it's again, it is common. It's, I mean, most of the time it's not severe, but sometimes it is. And yeah, just, and it could be scary even when it's mild, when someone especially does some searching and they read about it and they see pictures of what it could look like when it is severe. So again, thyroid eye disease is, it involves the same autoimmune process as Graves, so those thyroid stimulating immunoglobulins. So everything we spoke about regarding the immune system is extremely important, trying to address that autoimmune component. Selenium is great when it comes to, I mean, really just not just thyroid eye disease, but Graves, Hashimoto's. I know you love selenium too, Dr. Isabella, but but yeah, for thyroid eye disease, there's actually research also showing that it could help. Just helps anything that can reduce oxidative stress. So alpha lipoic acid is another one in the literature that's helpful when it comes to thyroid eye disease. I haven't seen anything with NAC, but NAC is also, that's a precursor to glutathione, so that also potentially could help. But berberine, so berberine in the literature has been shown to help with thyroid eye disease by modulating the gut microbiome, and some are concerned, like some, yeah, there's a little bit of controversy with berberine. Most of the more recent research seems to be positive with the gut microbiome, but I had Dr. Jason Horlick on my podcast, and he's not a big fan of berberine as far as the gut microbiome. There's some older studies that show that it could maybe like have a negative impact for lactobacilli. But again, if you look at the recent research, it seems like it's good also for blood sugar too. A lot of people use that instead of metformin, but from a gut microbiome perspective, it seems like. And again, I'm not suggesting to be on that long term necessarily, like for like a year, or like to have that as part of your regular supplement routine. But and the short term may be something to consider for thyroid eye disease. But I definitely would go to the basics. Like to me, selenium's a basic. Vitamin D, very important for healthy immune systems. And a lot of people have low vitamin D levels. So test vitamin D in the blood. If again, there's optimal levels, and then there's so if we like to see it, I don't know if you agree, but I like to see at least 50. Think it's nanograms per milliliter. Let's see, omega-3 fatty acids, important for helping with inflammation as well. So yeah, those are some of the remedies, the supplements that could help in the short term. But really, the main goal is to try to remove triggers, optimize gut health, as we've been chatting about.
I love that. And I think these are such helpful suggestions. I know when people oftentimes hear about thyroid disease, a lot of times iodine comes up, and I would love to know your thoughts as far as iodine and thyroid health go.
Yeah, it's definitely one of the more controversial areas in thyroid health, and just I mean, we know that that iodine is important for thyroid hormone synthesis. So there's no question that is an important mineral. Comes down to like the Goldilocks principle. Like, you don't want to have too much, you don't want to have too little. So what is too much? Because my perspective definitely has changed over the years. Like I'm definitely not anti-iodine, but I'm more cautious with iodine. Like years ago, I was one of those people who took high dose iodine and had good experience with it. And I mean, and again, I would have my patients initially when I was dealing with or after I dealt with Graves and started helping others with Graves and even Hashimoto's. I would have people do like urinary iodine testing, and if they were deficient, would recommend iodine. But then, of course, there's concerns about it being a potential trigger as well, potentially exacerbating or causing autoimmunity. And in the case of hyperthyroidism, sometimes making the hyperthyroidism worse. Again, like higher amounts of iodine sometimes could have that opposite of like suppressive effect where it could actually help. So there are people where if you visit like a Facebook group and you ask, just like, let's say a thyroid Facebook group, and you ask the experience with iodine, you'll definitely get some positive experiences. People like, oh, I took iodine and it helped my goiter, my enlarged thyroid. And then you'll have other ones where it's like, I took iodine and it worsened my symptoms, my hyperthyroidism increased. And in the case of thyroid eye disease, there's been a few people I know who took iodine, and again, that worsened the thyroid eye disease, which is not a good thing. So again, just I'm more cautious. I'm not against iodine, but just I don't recommend for people to like completely restrict like food sources of iodine. But on the other hand, like if someone wants to eat kelp, which is really high in iodine, I would say you might want to be cautious about that. Same thing with what's extra iodine supplementation. Like if someone takes a multivitamin with iodine, I'm not too concerned. I know there are other practitioners who are concerned. And again, I'm not saying that everybody's different. So some people might be a little bit more sensitive, and maybe they do better without the multi with iodine. But I find that most people, could tolerate a few hundred micrograms of iodine, per day between what's in a multi, what's in the food they're eating. So yeah, it's like I said, it's one of those questions where just over the years, I've become more cautious with about iodine, and especially like high dose iodine, like just taking milligram doses, especially like 25, 50 milligrams. Again, just if you're going to do that, work with a practitioner. Definitely don't do that on your own. And I've been there too, so I know that, yeah, like selenium and antioxidants are important, but even when people do that, sometimes it could cause problems. So love to hear your thoughts a little bit on what you think about iodine, though.
Yeah, thank you so much for sharing that. And I kind of echo your sentiments is sometimes high dose iodine can help people, and then sometimes iodine restriction can help people too. I've seen case studies of both. My approach is kind of like the amount in a multivitamin and a prenatal is going to be generally safe and helpful for most people with Hashimoto's. Kelp and, seaweed snacks and, really high doses of iodine. I have seen, unfortunately, people with Hashimoto's make themselves feel worse. So it's usually not something I recommend. And I'm like, there's so many different tools we have in the toolbox that are like pretty well tolerated and safe for a lot of people. Where I'm like, this is going to be like on my like, what's safe and effective? It's like I have like 20 different things to start with. And with iodine, it's kind of like risky, right? And so it's like, it's a narrow therapeutic index nutrient. And so it's not the first thing I think of when I have somebody with Hashimoto's. And in some cases, a person might react poorly to iodine because they're selenium deficient. So selenium is generally going to be well tolerated. So, like, why not start with selenium, right? And then if you have these really high thyroid globulin antibodies or thyroid peroxidase antibodies, sometimes that can cause some inflammation. And so why not like focus on getting those antibodies in check? And we know there's specific ways and research backed ways where we can do so. And so like why not start there first? That's my thoughts. And I know some people have done really well with high doses or even like iodine restriction protocols.
Yeah.
But for me it's kind of like okay, that's there's so many other things we need to target, right? Like I've seen people who had tried this high dose iodine, got really bad, and then we're like, okay, well, you actually have H. pylori and blasto, and we can find these triggers and a gluten sensitivity, and like now you're in remission because we address these other things. So it's like, out of the different triggers or considerations, it's like one of I don't know 50 that might be a factor, or it might just not be a factor for you at all, right?
Yeah, and one other thing I'll bring up, again, not to knock iodine. Like I said, I'm more like, again, I'm not anti-iodine, but just over the years, I've been working with a lot of Graves patients, and I can't, again, there's been a decent number of patients who, when seeing me on their health history, said this started when I like started taking like iodine supplements. Like they some of them might not have been sure if that was the cause, but it's come up enough where it's got to be like on the radar. And no matter how much I love Dr. David Brownstein and others who are advocates of like higher dose iodine, again, it's something I can't ignore when they again put it on the health history and say this is, I was taking whatever, Lugol solution or iodoral, just, and then that right after that is when I was like diagnosed. Again, it's not like it's just been like 2 or 3 cases over the years. I've seen a decent number.
Yeah, and it's like, as a pharmacist, I'm like the right drug for the right person, right? It's like, and the dosing of the drug too, I'm always going back to those things. It's like, you go to a health food store and somebody might be like thyroid iodine, right? But it's like, it's more complicated than that. Like, we've been studying functional medicine, you and I have for many years now. I don't want to age myself, but it's not as straightforward as just like one nutrient deficiency for
Yeah.
for a lot of people with autoimmunity. Unfortunately, like, do I wish it was like one thing? Of course I do. But it's not necessarily the case. Gosh, I've learned so much. Could we talk about where people can find your books, where they can find out more about your work, and the upcoming Save My Thyroid Summit, which is going to be, can you tell us the dates for that? I know I'm going to be a guest at the summit. I just don't know the exact dates and details. So I was hoping that you could share that with us.
Yeah, sure. So yeah, my books you could find on Amazon, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. Make sure you get the third edition, the most recent edition, and then also the Hyperthyroid Healing Diet. And then Save My Thyroid podcast, which, yeah, definitely listen to my interview with Dr. Izabella. And you could check out savemythyroid.com and click on podcasts, or just visit your favorite platform and type in Save My Thyroid. And then, yeah, the Save My Thyroid Summit, it will be taking place May 8th through May 11th. And yeah, very excited to have, again, Dr. Izabella participating, as well as many other experts, dozens of other experts, and just covering a broad array of different topics.
Yeah, and then so definitely if you go to savemythyroid.com/checklist and share your email, you'll get a checklist from Dr. Osansky, and then he's going to email about that. If you get onto go to thyroidpharmacist.com/gift, you can get signed up for my email list, so I'll send a notification about that. And then I know there's ways to get notified whenever we post something like Facebook, Instagram, YouTube. I can't tell you offhand how to do it, but you can definitely get like put us as favorites, because I'll also be posting this on social media just to make sure nobody misses this really important and life-changing summit. That, I mean, guys, if you know anybody that's struggling with Graves' disease, any kind of thyroid issue, you'll want to share this with them, because it can be a really life-changing information onto for them. And I know Dr. Osansky's on a mission to save as many thyroids as possible, and I'm so excited to support that mission as well.
Yeah, well, thank you again. It's been great, chatting with you, having this conversation. And yeah, you're right. There's a lot of people out there, not as many as with Hashimoto's, but still a good amount of people with Graves. That yeah, and a great thing that there is hope. There's a time and place for conventional treatment, time and place for thyroid surgery, but again, it is possible for many, if not most people, to save their thyroid. And it doesn't hurt to take a natural approach, as long as you're safe while doing it. So you just, as we're getting back to our early conversation, you want to be safe, not make sure it's not unmanaged hyperthyroidism. But yeah, there's definitely a root cause, just like Dr. Izabella wrote in her books with Hashimoto. So the same thing applies to Graves.
Thank you so much. We so appreciate the work that you're doing in the world and taking time out of your busy schedule to come and chat with us about how to save our thyroids. To everybody listening, I hope this has been very healing on your healing journey, and we'll see you next time.